Welcome to Washington State University College of Nursing. My name is Susan Blair, and I am your contact person regarding immunizations for the undergraduate pre-licensure program. The introduction and web links are specific to the pre-licensure program. However, the passport clarification is applicable to our RN to BSN and graduate programs as well. Your immunization records are required by the College of Nursing and the clinical agencies where you will be studying. They verify that all necessary immunizations are current. You should keep a copy of your immunizations in a personal file to remind you when updates are needed. If you are not already on the WSU College of Nursing page, open another browser and go to nursing.wsu.edu. On the College of Nursing homepage, click on Admitted Students. After reading through the Immunizations and Testing tab, download and print the Clinical Placement Passport Requirements PDF. You will see the link to the PDF at the bottom of the page. Clinical Passport Form. On page 1 of the passport, print or type your name and fill in the college program with BSN pre-licensure program. Read through the immunization information carefully. On the second page, print or type your name and add your date of birth. You may leave the rest of the form blank. Mail the clinical passport form and copies of your immunizations to me. WSU College of Nursing. Attention, Susan Blair, Program Assistant, P.O. Box 1495, Spokane, Washington, 99210. Now, I will take this opportunity to clarify some terms and requirements you will find on the Clinical Passport form. TB, tuberculosis. The first semester of the BSN pre-licensure program requires testing for tuberculosis, exposure status, or a TB skin test. This is accomplished by a test that has two separate steps. Step 1 is an initial injection that will be read within 48 to 72 hours. Step 2 is the same procedure done again within 4 weeks. It is called a two-step because there are two separate injections received and read on two different dates. It is preferred that this TB requirement is completed before classes begin. If you have tested positive for TB, you will not need a skin test, but will need to have a chest x-ray and a medical examination by your provider. A form called a symptom check can be obtained from the Student Service Office and taken to your healthcare provider for the review of your examination. Your healthcare provider will sign the form, and you need to return this to me. Let's talk about hepatitis B. You need 3 immunizations and then a titer to prove immunity from hepatitis B. This is a requirement by healthcare organizations in our community, and the overall goal is to build up your lifetime immunity. If you have had all 3 immunizations in the past, you need to have a blood titer drawn. If the titer results are negative, you will need to begin the 3-step series again and then have another titer. If you are still not immune, you are considered a non-responder and you have completed the Hep B requirement. The timeline for hepatitis B immunizations is as follows. Between the first and second injection is 1 month. Between the second and third injection is 5 months. Between the third injection and the titer to prove immunity is 6 to 8 weeks after completion. MMR, measles, mumps, rubella. You need 2 immunizations 4 weeks apart or titers for each to prove immunity from measles, mumps, and rubella. Varicella or chickenpox. You need 2 immunizations 12 weeks apart or a titer to prove immunity. Tdap, tetanus, diphtheria, and pertussis. You are required to show proof of 1 dose of Tdap. After your first Tdap, you will be required to receive a TD booster every 10 years. Influenza. A seasonal influenza immunization is required prior to October 1st. Medical facilities have the option of not accepting students if they do not have the immunization. If admitted without the influenza immunization, some medical facilities may require students to wear a mask for their entire clinical experience during the official flu season. National Background Check, Washington State Patrol. Your first background check will include the National Background Check and the Washington State Patrol, known as Watch Report. You can order this report at certifiedbackground.com. I will download the final report from the Certified Background Check website. If there are findings on your background report, you'll need to write a letter of explanation to our Program Administrative Manager, Renee Richter. Each fall, you will be required to do only the WSP and bring a copy to the Student Service Office for your file. Healthcare organizations have the option of not allowing students with positive background findings to study at their facilities. Authorization of release of records. This form permits WSU, upon request from medical facilities, to furnish the information contained on the passport to all healthcare organizations accommodating your learning experience. There is a link to the form on the College of Nursing website. Clinical modules. Completion of clinical modules is required for placement in clinical agencies. You can find directions at cpnorthwest.org. Login information will be provided for you. Each module must be passed at an 80% minimum. Completed copies need to be printed out and given to the Student Service Office for your file and passport. A new series of modules are required each fall. CPR Cardiopulmonary Resuscitation Card. A current American Heart Association BLS Basic Life Support Healthcare Provider Certificate is required. No other course is accepted. The skills learned provide a wide variety of healthcare professionals with the ability to recognize several life-threatening emergencies, provide CPR, use an automated external defibrillator, and relieve choking in a safe, timely, and effective manner. If you have any questions or concerns, please contact me at 509-324-7338. I look forward to meeting you.